It's the fog.
Okay, we can get started. Human Services Committee meeting, any courtesy of the floor? Seeing none, Lori's here from Area Agency on Aging with her annual report. Good to see you.
It's great to be here. All right, so I will go through each of our units and then just give an overall agency update. it-
Can she introduce herself? I have no idea who she
I'm
is.
sorry, would you introduce
Oh,
yourself?
I'm sorry. I'm Lori Grieco. I'm the administrator for Area Agency on Aging.
Thank you.
I apologize, gentlemen.
So I'll start with Protective Services. We continue to grow that unit. We have hired a new supervisor. She is assisting with case assignments, quality assurance that we get from the state, assisting with that. We have also hired a case aide. The case aide is assisting the investigators with collateral contacts in the community, reaching out to doctors' offices, police departments, helping maintain the case files. We've hired an RN. She serves as a consultant basis. She's also fully PS trained, so she can fill in to do investigations as well if we need her. So that brings our staffing now to 5 investigators, 2 supervisors, 1 case aide, and RN. We also have non-protective services staff trained in protective services, so they can fill in if needed. I'm protective services trained. Our deputy administrator, quite a few of our supervisors are, and we continue to have regular care management staff completing the training, and they're assisting with on-call. Community visits have resumed. They utilize a screening tool prior to going out, if appropriate. Certainly some cases don't warrant giving a heads up before we would go out, but staff are using PPE. They're taking it out to their home visits, offering it to the consumers or to the people that they're interviewing as well. And our Protective Services annual plan has been approved for 2021, so we're excited to move forward with that. Our senior centers, they are not yet open. Despite the fact that we've been closed, our senior center staff have met all of their health and wellness goals for fiscal year 19 and 20. They were very creative in keeping people engaged. They continue to be very creative in keeping people engaged, so we're very proud of that. They've been doing things as a remote capacity or drive-through capacity. They're doing border bust and bag distribution via drive-through. Care managers are also taking those out on home visits, and they have little activities in them, some games, hygiene items, just cute little goodie bags that we can put together. And we're going to continue to get creative with that as the year goes on. We hope to get even some craft activities, just different things to help people stay engaged. They're doing call-in bingo, that there's a particular day and the bingo cards are distributed in those bags, and it's almost like a phone tree. So one person calls, gets the numbers, and calls another person, calls another person. So it keeps them all talking to each other as well. Drive-through coffee and donuts. We had been delivering home-delivered meals to the adults identified at greatest nutritional risk. We're continuing to do that 5 days a week for them, but starting in November, we're going to be offering 2 days a week of drive-through hot meals for people if they want to come in that way. It, again, would be, masked and taking all the precautions to keep people safe, but they could come and pick up a hot meal, kind of get a little bit of socialization. They're regularly calling the participants weekly, sometimes more just to check in. They've been planning the Walk with Ease walking program, which is part of our health and wellness initiative, planning some of those to be outside in a park around a track, maintaining social distancing. And we have arranged for a drive-through flu shot clinic for our senior center participants. I believe there's 5 dates for that, and that's just for the senior center participants because there's just enough demand that's how we can accommodate. Options program, community visits have resumed for that as well, utilizing the screening tool again. They call and utilize the screening tool when they make the appointment and then the day of the appointment, just to confirm that everyone in the home is healthy and safe and comfortable with our staff coming into their home. And again, they're using the personal protective equipment and taking it out to offer to the older adults and their families at the time of the visit. Our assessment unit that goes out and does functional eligibility determinations for waiver, those numbers had gone down, but they're going back up again. And again, just like with all the other units, they are doing those in the community. Some of them are done over the phone if people don't want a worker coming into their home. They are able to do those via phone. Our caregiver program is growing. We are growing our grandparent program. We recently added a great-grandparent who's a caregiver, and so we're helping to support that. It brings us to 4 grandparents, aside from the other caregiver people, but it is a great program, and we are excited to
Do you
continue
want to say a
growing
little
it.
bit more about that?
I'm sorry?
Could you say just a little bit more about that?
Oh, sure. In the caregiver program, we are able to reimburse families who are caregivers, either for adults or for youth. So grandparents raising their grandchildren, they would submit receipts and there's allowable expenses, and then we can reimburse them for that. Our prize program is preparing for open enrollment, begins October 15th. That will all be done over the phone unless it's an exceptional circumstance. So people have Medicare enrollment questions. And our ombudsman program is contracted out to Catholic Charities, and that went into effect today, actually. They've taken over administering that program.
Can you speak about that? Because I had a call about that. I think that got referred to you, and I spoke to somebody. Can you speak a little bit more about what happened with that?
With our ombudsman program, when the previous ombudsman supervisor retired, there were no ombudsman staff aside from her, and it was just volunteers. And we didn't have anyone else who was trained as an ombudsman, and unfortunately, you cannot be both protective services and ombudsman. It's a federal rule, and we needed our protective services people. So I was overseeing our ombudsman's volunteers from a distance. I would take the referrals and just refer directly on to them. I certainly didn't have access to their computer system or any tracking mechanism at all. And in order to fill that position, we would have to pretty much hire someone exclusively just to be an ombudsman. And in talking with our aging network, a lot of the counties were contracting it out to different entities, so we kind of looked into that. We looked into different like regional contracts with our area agency on aging region, and we ended up meeting with Catholic Charities, and it seemed like a very good fit. We actually co-contracted with Lehigh County Aging as well, so they're covering the ombudsman for both Lehigh and Northampton counties.
Okay, thank you.
And then an overall agency update. Really proud to say that all of our aging programs are currently compliant with state regulations, so we're pleased with that. And our 4-year area plan has been approved by the state. Our goals are consistent with the state plan on aging, so we're excited to make some of those things happen. A lot of our goals were set figuring we could be more engaged in the community, so we're going to find creative ways to do it and hopefully be able to get out there more and get more engaged with the community and reach out to more individuals.
Anybody have questions? Go ahead.
Thank you. Your division was always one of my favorite because you don't get much money, but you have a tremendous impact on the community, and you always have. You mentioned the senior centers are closed. My question would be then, what about the contracts with the facilities? Is that affected in some way? I don't know how we're doing it now. Like, you contracted with them for a certain amount of time to host the senior center. So was that funding canceled, or were the contracts suspended, or we continue to pay them?
Yeah.
Okay, and the people that came then, and you mentioned meals, but like, I know you can't do the socialization, but the meals, are the people that would come for meals, have they bled into Meals on Wheels, or are we doing some of that directly?
We've been able to enroll them with the Meals on Wheels due to COVID. Obviously, so many things have changed, and
Right.
typically they would not be eligible for, that would be an options-funded
Right.
program. They wouldn't be eligible for that because they're eligible for congregate meals, but the state has allowed us to enroll
Okay.
them. So that's why we're able to
they've
give them
given
5
you that
meals a week.
leeway. Great, thank you, that's all
Mr. Myers?
You asked one question, which I was going to ask, this is perfect. How many senior centers are we utilizing in the county? Do you have any idea?
How many senior centers do we have? We have 10. Some of them are ours, some of them are like leased out spaces or working in cooperation with a high-rise, like Old York Road Center in the Moravian House building. That's not our own, but we work with them.
Could you tell me the rest of them? I'm the new kid on the block.
I could get you a list of them,
That'll work.
sure.
I'm done.
Every time you say that, I hear a song. Go ahead.
One quick question. John Mailer ran that division for a very long time. And I was just wondering, since you've been in the position, have you made any changes to any of the programs or things that he did, or have you just continued? Maybe you can just, what your experience has been since you've been there and following someone like John who had been there a very long time.
Yeah, any changes that we made were made to supplement our programming or to come into compliance with ever-changing regulations that we get from the state. We have grown our protective services program significantly, and now there's a dedicated supervisor. I think that was a big change that we made, a needed change, and now we have a second one.
Thank you.
Do you have any numbers? How many people are impacted by these senior centers being closed?
Oh, wow, I could get that for you. I
Okay,
can't even
if you
venture a
want to
guess.
just send that into, I just wonder how many people, because that's, you have the most vulnerable population. And I just wonder how many people are unwilling to let people in, or, and what have you done to help the consumers understand COVID, alleviate their fears? I mean, because, some of your folks are their best point of contact to understand some of those things. So what kind of educational stuff have you given out?
Yeah, like I said, the senior center staff especially has been reaching out to the people most impacted by not being able to come to their centers every day. So they do reach out regularly and try to have supportive conversations as far as educational material. There may have been information put into those boredom buster bags, trying to keep people, informed of what's going on, but we just really try to stay engaged with them over the phone.
Go ahead.
Just one question that I looked at and I didn't ask. Do we engage in trying to get our elderly to take their flu shots?
We offer it.
That's what I'm asking.
Yeah, I mean, that's why we have it set up for our senior center participants. The drive-through flu clinics are just for them, actually, because of the demand that we're having.
So now with them not being open, you're gonna set up a drive-through type scenario? Is that what you're telling me?
Yes,
Okay. And what's the eligibility for that?
you need to be 60 and over and a participant at one of our senior centers.
Oh, shoot.
That's the only,
I was
okay.
gonna go.
Yes.
Oh, wait, next year.
I'm older. I'm old enough.
Because you mentioned about COVID. I know Human Services and you got DPW regulations come all the time and they're changing things even in the best of times. But during COVID, has your department, I know Graysdale certainly has, have you gotten hit with unique regulations or changes? I mean, I know closing the centers, that made sense, but have they sent down some new things that you should be doing or you have to do during the COVID?
Yeah, there had been and continue to be weekly calls with the Department of Aging, and there were COVID work groups and reopening work groups, and they provided us with guidance tools. They left all the ultimate decision-making to the local level, but the tools were very helpful, and it was a good tool to have, like the screening tools, for example, and just the guidelines of what was expected.
But they haven't hit you with new mandates specific to COVID, have they? Your department? Oh, okay, your
No,
division.
no.
All right, thank you. I was just curious.
Any other questions? I have one more. Do you have any dementia-specific programs or dementia assistance?
We're actually working on growing that. We're getting all of our staff trained as dementia friends, and we really want to work that into our programming at the senior centers and our caregiver program.
Because I told somebody to call you. I mean, I see there's, I see that as a growing need, that there's people that don't need to be in facility, but they have caregivers and people that are trying to manage them at home. And so I just wondered if you had, and so when you have it, come back and let us know. so we
Definitely.
can
Sure.
advertise that. How long have you been in the job?
Um,
Is it 2 years yet?
It's almost 3, 2018, January, yeah.
Oh, wow. Yeah, so thank you. And to hear we're compliant and no problems since you've been here, it's fabulous. Thank you so much for everything you and your staff do.
Thank you very much.
Because I'm going to need you sooner than later. Got a big birthday coming. I'm ready going to get the, yeah, you might want to. Melina will sign me up. I was going to say, let this one go get his flu shot. Come on up, Grace-Dale. The next. Hey. You could get their program.
Good evening. So while Brian passes those out, I did want to give you an update on our visitations that we've been having. So we did our testing on the week of September 13th. So after that, and we cleared everything, we were able to open up to visitations. So from 9/23 to 9/28, we had 246 visits scheduled. 62 so far were completed. So that was a nice number. We've been getting numerous phone calls and cards and thank yous from family. And just, I watched some of the visits and it was.
Could you say the number again?
So it was 246 visits were scheduled as of 9/28. 62 were completed. And they're just calling still in droves.
Good.
So if you want to do, we'll do the report. Census at Graysdale, today's numbers are 537. So that's 77% occupied, which is on par with what's happening across the nation post-COVID. So we are right on par with the rest of the United States. And every day we work hard. The admissions offices, marketing, getting people in. Hours of patient care per day is 3.13. Cost per resident day. July's cost was $335 with a year-to-date of $425 per resident day from January to June. The Medicare per diem rate was per day was $413, and the room and board portion was $295. So Graysdale's finances, the revenues are $6,473,573. So we're $61,190,000, and expenses have been $53 million. So we still have a fund balance of $3.3 million. Graysdale's admissions and discharges, we again, like I said, continue to go up in our numbers. So we had 29 total admissions. There were 133 inquiries. The discharges were 27, so you can see how it's trending downward. From June, we had 48. July, we had 30, and August was 27. So again, we have the COVID-19 on the back page, which goes over our current numbers, which we are still at the 245. We have one person pending. Total residents resolved was 170, and the total positive of our patients that have passed away have been 76. Employees, we still stand at 57. So with the universal testing, there were 535 residents asked to be tested. 7 had refused. And 614 employees were tested. Mm-hmm. So it was our first universal testing we did ourselves. We had a core group that manned the clinic area. We had teams set up to go to the units for the employees. For the nursing employees, all the ancillary departments came down to the clinic area. Dawn and the infectious control nurse did all the testing. And then Brian, I ran the lab testing part of it, and then our secretary ran the numbers, so it was quite a group, but we did it, so looking forward to next one. We're just waiting for supplies, because as of right now, we cannot get more test supplies for our POC machine, which is what we used last time. It's the point of care. And we're awaiting our new testing kits, which come from Abbott. They're called Binax Now, and they're the size of like your badge, and we still don't have them. So we're supposed to do that.
Is that because there's a backlog, or?
No one, I can't get answers from anyone. I have emails and phone calls out to everybody, but as long as we document, we've been trying to get these items, we're good. But we're supposed to be starting testing it's the second full week of October, which would be the 11th.
Any questions? Oh, wait, did I miss John? You have to wait for
Oh,
one.
you can go. Go ahead.
I didn't see, you gotta get quick.
You have the new things where you put your face?
Yes.
Good. I just want to check. Has
That was weird.
DPW, what are the rules now regarding accepting COVID-positive patients? I know you had to. Is that a continuing policy from DPW or?
It is, from the Department of Health, it is. But again, you have to check a few things before you can accept, to make sure where they are, where they tested, how long they've been in, so you can see where you can put them. And then you would place them in your colored zones. So Graysdale is all green right now because we don't have any cases. But once we had Tower 10, that would be considered a red zone, so that's where they could go. Or a yellow zone would be maybe if there was somebody who's pending, they would consider that a yellow zone. So that person would go in the red zone.
But they have to clearly identify if they're sending you someone and.
Correct, right, they
Okay,
must
and
tell us.
The last thing is, I just want to congratulate you and all your staff, and I think you please tell them, I mean, given the size, given the situation and what happened and what we walked into this year, the fact that you know, the staff, I mean, it's, I mean, one death is too many deaths, and that's never taken lightly. I mean, but with the employees, we've been fortunate, thank God, but also thank the diligent efforts that have been made by everybody. And, you know, I wish you all the best going forward. And I personally, if there's anything we can do up here, let us know. That would be my message.
Thank you.
Yeah, first of all, I'd like to congratulate you on increasing the census. So that's a step in positive direction. Couple questions on the surplus and the finances. Right now, there's a significant, there's a lot larger revenues than there are expenses. I guess my question is that related to the IGT or the CARES Act funding? It's a lot. Usually they run somewhat close together. Are we looking at a result of the outside funding? or-
I'll let Brian give the specifics,
Yeah.
but yeah.
Yeah, it's kind of a combination of a few things. Primarily right now, it's the additional CARES Act funding that we've received from the federal and the state governments. Also, because of this being one of our first transition years in CHC, the way that IGT and nursing home assessment fees are paid out are a little different. So we're actually going to see an additional 6 months of IGT because we used to get that annual bulk payment.
Yeah.
But now it's monthly. So we received payments in the first 2 quarters of the year for CHC, and we had a half-year bulk payment because of the transition in June, and now we have an additional 6 months at the back end of this year.
Okay.
So that's gonna
yeah.
increase too.
All right. So I was wondering, usually they run somewhat, those two numbers were so significantly different. That normally doesn't
Yeah.
happen. So it's just because of the transition to the new payment mechanism. All right, that makes sense. My other question had to do with staffing. I think the issue was raised at our last meeting. I thought your answer was somewhat opaque. Where are we with regard to staffing? I know it had been an issue, and if you could clarify what, as far as, I think it was FMLA, IFMLA, and folks that were taking leaves of absences, have you seen a turnaround since we've gone to 0 cases?
There's been still call-offs. People are.
Well, we always have call-offs. I mean, is
They're
it,
exhausted.
Okay.
They've done a lot in the last 6 months. We continue to hire. We just, as a matter of fact, I was going to mention that we have 2 people who joined up for this new pilot program we have. So there's 2 people officially starting where we're going to pay them to get their certificates. So that was nice to see, since we just started that program.
Which certificates? I'm sorry.
The pilot program, it's for nurse aid trainees.
The CNA?
Yep, that we're going to be paying.
Thank you.
And I guess my final question is, you're asking for an extension of hazard pay, and, you know, we heard from Moravian College, they're doing the same thing, but I guess my question is, if we're at 0 cases, why are we asking for hazard pay if it comes up in the future? And, I mean, could you just talk more about that? Because it seemed really, the resolution in front of us is very broad. It asks for 20% throughout the home. I guess, yeah, I understand for the folks that are working in the isolation unit or directly with patients, but if someone's working in the office, is that?
So we're requiring everyone to get tested. So that's monthly. And then if we do have a case, we're expecting them to do weekly. So, I mean, yes, we don't know when COVID may or may not come back in, but that's a lot to expect somebody. And anybody having undergone the test is just very intrusive. So they're doing an exceptional job of keeping it out of the building by using the proper PPE, by going above and beyond what would normally be expected of them, just to keep it out. And I think to ask for 20% of money that's coming in for the CARES Act, which is just going back to them, that's.
Okay, that was my next question. Does it come directly
Right.
from the CARES Act?
Which the portion that allows us to do this, because, you know, with the infectious control, we need them to do more so, be more vigilant. I mean, they should always be vigilant, but now we're fighting something we can't see. So we're asking them, not only do you have to do your job, but clean up after you. Because housekeeping has a tough enough job doing what they have to do. So we're asking everybody to do so much more.
Okay. I just, like I said, I understand for the direct patient contact, but my question really had to do with someone that works, like, someone who works in the back office. I didn't see
But they have to
why.
be tested the same way, and they have to keep their area clean.
But are they limited to the back office? So like during COVID, were they all just sitting in the back hiding, or were they helping too?
Residents still want to get paid, so they do their payday runs. We're still meeting with families for Medicaid. So they are putting themselves out there.
Mr. Meyer, sorry.
You answered the question I was going to ask. They weren't just sitting in, they actually are doing, some might be done with their office job and going into the wards to help them out?
Right, absolutely.
So they did indeed get hazard pay, correct?
Right. And you have people in the business office who are doing the billing. They've got to make sure, because it's ever changing with Medicare and Medicaid, how they have to keep on top of everything and what they're submitting.
Okay. PPE,
Yes.
are we supplied? Are we waiting for more to come in? What's our status with PPE equipment?
We are very healthy in the PPE department. We continue to gather, but we are very healthy. Test kits is what our big concern is right now, getting these test kits in so that we continue to do our universal testing.
Because if we get a second wave, you already got lined up several people you can contact to get your hands on stuff?
Correct.
That pretty much answers my question. You prepared yourself for the second wave, that's correct?
Yes.
I'm going to leave you alone then.
Mr. McKee?
Just to follow up on Mr. Kusik's question, the grant money that funds the COVID, the 20%, how long is that? Is there a statute on how much you're going to get? Is there a limit on, is there a time that the valve gets shut
Yes.
off?
Yep. The government gave us, there's federal money and there's state money, and each one has its own expiration date.
So we had an effective date, but we didn't have, like, how long does it stay on for?
So the COVID money would only be till December 31st.
Okay, oh, it's for the rest of the year?
Yes.
Okay, all right, that's all, thank you.
Yeah, go ahead.
So the state money has to be used by the end of this year, December. The federal money, that gives us a little bit more of an open window. There is federal reporting that is due 45 days after the end of the calendar year to the federal government. But then we do have, if there is additional funding that hasn't been expended yet, till June 30th. And then by July 31st, there's another federal report that needs to be submitted.
I think it's great that you went after this to help the employees out, and if it's not really coming from the county coffers, it's great. So, thank you.
Mr. Lot?
To follow up on Mr. McGee and Mr. Kusik's question, my concern is, if we get hit real hard in a month and a half from now, are we gonna have the money, if we get COVID back in there, to pay, at least to the end of the year and to the beginning of the year? So that's, my concern is, we jumping in a little early on this or not? The other thing is, I also agree with Mr. Kusik, there's some people in that have to work directly with COVID patients and other people in the back room. But I kind of like, part of me, that why are we having people in the back room? But I kind of like that because it seems like you're giving more money to the people that have hands-on. But what I would be afraid is if you gave one group of employees that bonus and we had a little bit of that and another, then you disgruntle all the others. So, by giving everybody a little bit and people more.
Right.
So, I have kind of an issue with giving people that aren't kind of front line, but then we got to look at the morale of the whole building, and it is truly a group effort to keep this out. So,
Correct.
I do understand his concern, but I don't know how you get around it, quite
And
frankly.
we do have the money there. So the money is there that even if we have a case and we have to go to the 25% or even the 30% for Tower 10, because those are people working in the isolation zones, the money is there for that.
So what you're saying is everybody's going to start at 20 because there's no, and then if we have cases, you jump up to front,
Right.
so to speak, front line guys.
Correct.
Got it. Thank you. Very informative.
Mr. Heckman, you had a question?
I mean, with the money, I think it's important to note, and I understand where John's coming from. I mean, I asked a similar question regarding the higher education places, and but with Graysdale, I mean, it's almost an insurance. The money's there, and like a lot of human services, it's a use it or lose it in certain things with that, and that's DPW. So you talk to your state reps, and they could come up with a better formula if you want to save money. Or something, or maybe worse formula, I don't know. But the thing is, so I don't have a problem with that. And as far as the hazard pay, I mean, right now, it is like insurance. I mean, you are at a great place. Mm-hmm. And I said this before, I mean, by the grace of God and the hard work, that's where you're at, and you want to maintain that. Mm-hmm. So my concern would be, I mean, that, yeah, if you're telling us the money's there and it's not going to impact next year, because I've talked to Ms. Hefner about this, I fully expect that we're going to see a little spike in the winter months. I mean, and despite all the talk at the upper echelons of government, I mean, talking to some doctors I've discussed it with that I've bumped into and know, they don't think there's anything real that's going to get to most. Your people probably the soonest, but they're not talking before the end of this year, if that. I mean, and that would be, vaccine? Yeah. I mean, and how effective it is. So I mean, I want to keep the staff knowing that at a place where, okay, we got your backs. It could just take one person. You got to do all these tests. I mean, if one positive person would walk in there for 2 weeks and we missed it, God knows what could come of it. So, I think it's a fair expenditure, and if we're going to spend it someplace in the county, I would do Graysdale. Not so much today, maybe, yay today, but my concern is next week, next month. I mean, I hope I'm wrong, but as we go inside and as people get tired of these things, and who knows, right? I mean, we're gonna do our meetings. I even talked to the IT guy because I said, just so you know, we may have to jump back to virtual.
Right.
So anyway, I just wanted to react to the money because I think it's a legitimate and fair usage. I think the taxpayers are getting a legitimate use out of it. I'm finished.
Thank you. Mr. Myers?
I just want to clear up something so I understand this correctly. Some of the folks you got working in the office when they're done at night go into the wards to help out. Is that correct?
Well, there's some departments that do. So you may have a beautician that after she finishes doing hair, she goes and works as a CNA. Right.
So they will get some of the hazard pay.
Correct.
So it's not being misused. Okay, that's my question, because I kept hearing that we're giving, but we're only giving the people who are actually staying on to help out those that are in need. So I don't see where the problem is.
Right.
Is there any way to incentivize this money? Now, this is how much I don't know about finance. Here we go. You have all these people calling off, right? Do they get hazard pay and then they
No.
get to call off?
No, you must be working, which working hours.
I mean, I would think it would be an incentive to not call, yeah.
That's
that
a,
if you
that's a
have
good
too many
issue, though. Is there a
call-offs-
limit on how many hours they have to make the week to qualify? That's a really good point.
So there you go.
No, it's hours worked, so coming in the door and working qualifies you for it.
I just would tie that in. And I guess the only other question I had, how are we doing with our employee recruitment programs? Like, other than the CNA, we had the nursing,
The
tuition programs. Are we getting any hits from that?
We are, of course, with COVID, it knocked everything out, but
Sure.
we are continuing working with the colleges and trying to recruit people from there. We continue. Every stone is not left undone.
Talk to Moravian. They were here. They told us they fund the nurses. We're going to be helping them out. They maybe can help you out.
There you go.
Hey, alma mater.
For every little bit, they have to send one over.
Do you have any safety protocol changes? I know that at the hospital, we now have to wear goggles all the time. Do you have any?
The goggles come into play when you have a case. So we don't have to wear goggles at this point because we don't have any cases.
See,
Surgical masks are what we can wear. We're not using the N95s. Gloves, obviously, normal protocols with gowns when you have somebody who has projectile coughing.
do you have a lead on the goggles, just in case? If you.
Oh, yeah, we have them.
Okay,
No, we have them, and we have the face shields. We have those. We have
Okay.
plenty.
all right, that's it. Next month, would you talk a little bit more about the Dementia Program? And I'll forget that I asked you, so if you'll remember. That's not a joke. And Haven House is still there? Still
Absolutely.
active, still working?
Mhm.
If they can come with some data as well, or if you want to bring some data, or it would be nice to have an update on that program.
Absolutely.
And if they've expanded it at all in terms of fear, COVID, debriefing, any of that kind of stuff that they're doing?
Yeah, and to me, they were essential workers, so they've been in through it all.
Okay. Thank you so much.
Thank you. Have a good evening.
I echo what Ron said. Thank you. Sue, you're up, but should we discuss the housing consultant contract first? If we could just flip-flop that and get that taken care of?
Yes, I was, sorry. I don't need one. No, thank you. That's only for pumping gas. Yes, I don't have much on my normal business agenda, so I was going to jump right into that if that worked for you, so. So DCED and DHS have been talking pretty much since shortly after we all started on housing and housing needs and how on earth do we start to tackle this giant beast. And ultimately, we've done a lot of different programs, right? We talked about the CMED program tonight. We have the Rapid Rehousing Program. We provide funding for a lot of provider agencies related to housing. But I don't think any of us in county exec were satisfied with sort of piecemealing it and wanted to really come up with a strategic plan for the entire county. But realizing that none of us had that expertise and ability to to obtain all the different levels of information and, of course, the time. So we put out an RFP pre-COVID, it feels like. I'm sure it was, but it's a blur since then. And ultimately, in the last couple of months, we whittled down the proposals after doing interviews with some, I think, 3 or 4 different consultants. And so we have made a recommendation to the county exec on a specific group of folks. The Reinvestment Fund and Atria Planning are working together. And I was going to go through just a little bit of detail, if you are interested, as to what they were going to do for us as part of this strategic plan. So, I'm sorry?
Do they have a copy of that?
I don't think so, but I can,
We'll make sure we
Sure. I can get you a copy of it when I'm done. I can provide it. So there are a few different key things that they will be doing for us. The first thing is an analysis of the demand. So I'm going to talk for an hour, but I promise I won't. But some of the things that they'll look at are employment statistics, an analysis of housing affordability by occupation and wages, changes in the number of households, changes in housing supply, examination of housing types and the age, migration patterns, and looking at the population with mobility issues, disabilities, Social Security, supplemental security, homeless, at risk of homeless, and elderly folks. So a very large encompassing. Like for DHS, I always am thinking of the homeless folks, disabled older adults, and really housing is so much more than that. So that's the first piece that they will look at, and they have, of course, outlined a variety of ways in which they will come to complete that analysis. The second deliverable, if you will, is looking at the housing supply, housing conditions survey, and community engagement. So they will take an inventory of affordable housing in Northampton County, inventory of for sale and for rent housing. They will look at housing demand and housing conditions. So they've done, the blight strategy, so they look at all different types of things regarding the condition of the homes in the area. And part of that deliverable will be conducting online surveys, focus group meetings, and meeting with stakeholders. So one of the things that DHS and DCED did together was identify a lot of the key players in Northampton County related to housing. And so the consultant will make sure to have conversations with and interviews with all of those folks to pull all of that data together into one place as well. The third deliverable is the Housing Needs Assessment Report. And so that part will address, at a minimum, some of the following. There's a good list. I'll just give you some of them. Accessing and maintaining homeownership for low and moderate income households. Affordable rental housing for a variety of demographic groups. Housing as it relates to quality of life and equity issues. And that was a big factor for us, and a component that we discussed was also looking at the different inequities in housing across different areas. Housing and supportive service needs for older adults, workforce housing needs. Our terminology changes all the time. It was affordable housing, then it was workforce housing, and now it's obtainable housing. So they are somewhat interchangeable. So you just have to try to keep up. Trends in future housing demand regarding size, price, and amenities, and a review of current land use planning and state and local policy for housing programs. So we've talked about different parts of the county that have different, available land for building, but a lot of those places don't have easy access to bus transportation. So there's just so many factors to consider that, hence why we needed a group of folks to help us. And then, of course, the final deliverable is the strategic plan that they will create. So we asked for a 5-year strategic plan, and one of the things that we are finalizing is the ongoing consulting then for the next few years. So we have a plan. Once they have a plan for us, which is a 6 to 8 month process to get a plan, then we can utilize them on a much smaller scale to figure out how to start implementing the plan that they provide us, right? And ultimately, it will be figuring out, okay, here's your plan, and these are the pieces that you can actually tackle. Because if we had, unlimited money, we could solve a lot of the problems, but that's not the case. So it's about leveraging a lot of different resources, pulling in a lot of different groups of folks to make this work. So I think we're middle of the road for price, and ultimately we asked them to come down a bit. So the total cost is $120,000 to do all of this initial work. And I will tell you, I just wanted to tell you how many hours, manpower hours that gets us. My glasses are fogging. I'm gonna have to look at that then when I can see, and I will let you know. What I do know is that there was another firm that we really liked as well, but this was still our preferred group, but ultimately, they were about the same price. But the reinvestment fund folks, there was about, I think it was close to 300 additional manpower hours that they were providing us. So the other, even though the other firm was about the same price, their hourly rates were much higher. So that is a super brief overview.
And what's the name of the company again?
Reinvestment Fund, and they're also partnering with Atria Planning, ATRIA.
And where are they from?
Philly, I believe.
We didn't get any local bids?
We had one local bid that, it was an interesting process. We brought them in for an interview because they were local. But at the end of the day, it just was not even a close comparison. I mean, fantastic folks. And sort of, we were kind of rooting for our hometown people, but the group that we did select, they already have a lot of this data for Northampton County because they did one of the blight projects for us.
Oh, okay.
This was, DHS was not involved in that. So, so they already have a ton of our data that they don't have to spend time compiling. So we're, sort of even more bang for our buck than really using anybody else.
Questions? Mr. Law first, and then Mr. Cusick.
A lot of this information, I believe, the Lehigh Valley Planning Commission has.
Yep.
We give them a lot of money. Was there not a thought of having them do some of this, or that's not in their wheelhouse, or?
We have identified them as a group of folks who have to be involved in this process. They are not the right group of folks to create this strategic plan for us, looking at all these different things. But granted, there's a lot of data they have, there's a lot of, as the planning pieces of what they do, that we will incorporate into the final outcome, but.
Yeah, my thought was, we're already paying, let's pull some of that service back to us, but it sounds like you're incorporating that into it.
Absolutely, and we have to, they're just not the right folks for this particular project.
Go ahead.
Yeah, Mr. Lott covered my question, but I came up with another one.
Sure.
So we're going to pay this money, and I'm sure they'll come and they'll give us a PowerPoint, and we'll enjoy it.
Pretty things, yes.
But then my question is always, well, what do we intend to do with it, with the data and the presentation? Is there an action plan that you expect to use from it?
That's the.
It is our expectation that part of the plan has identifiable and achievable steps. So there are certain data points, which I don't have off the top of my head, that we identified as being important to us, that we want to be able to measure the change, consultant and strategic plan and post. So there is no point in spending, well, $10 even, let alone $120,000 on something that is just going to look pretty on a shelf. So the goal, I think, really, and why DHS and DCED partnered, is because of the different leveraging of funding sources. And instead of just, throwing this pot of money at these folks and this pot of money here, to really figure out, with all of the funding sources and all of the programs we already have in Northampton County, how can we make the most use out of that, and achieve the most, as much of the plan as possible. I have no expectation that we will be able to achieve every action step they give us, because the pot of money is not unlimited. But absolutely, to your point, I really couldn't agree more.
So who drives the bus? Like, who creates the goals? They do, or you do, and they have to deliver? Or how does it?
I mean, it's a joint effort, but ultimately them, because I think we all know, from a DHS perspective, I want to fix the homelessness and the mental health issues, right? And then DCED has this whole other kind of piece of housing that I had not considered before working here. And then one of the groups we talked to, and we're incorporating it in with these folks, is how about the moderate income level folks, and how do we maintain those neighborhoods? So different things that we hadn't even thought of that are, I'll say, more of a DCED kind of area than DHS. So they need to know what we want, but they will be the ones to come up with the action steps, because that's their knowledge.
And Lehigh Valley Planning Commission cannot help because?
No, I didn't say they couldn't help. But I'm not I don't know if we want a DCD person to comment on that.
I mean,
They
I've
have
heard
to
what
help
they
and be a
do, and
part
I've
of it,
heard their
but-
planning stuff. I mean, I've heard their reports. I don't think they go in as much depth as you do, but
I don't,
I'm
it's
wondering.
my understanding that there's not the level of involvement related to, thank you.
So we work, well, no, because you.
I think that was a more
spinning.
political question, I'm
The,
sorry.
and not, and through no fault of your own. So so with the blight plan, we worked with them. We paid them more than we pay them, and then they got a consultant. Okay, so in one way, we're cutting out the middleman here. Mr. Lott, you're absolutely right. There's all kinds of data floating, because we see it all the time. We see it at LVDC, we see it at the Planning Commission. There's a ton of data out there. But Sue, Tina, myself, you, we don't have the expertise to pull all that together and bring forward a plan to address these issues. And either does the Planning Commission. So, they would go get a consultant too. So let's not pay them on top of what we already pay them, and let's get this done.
Sounds good. So is this, do we need to
I'm
review?
sorry I was so loud. That microphone
It is
is very
louder
loud.
today.
I was not yelling.
Do we need to review this at finance then? Like, you're
Yes,
gonna have the
this is-
specific
I
things?
You
just-
don't have it in front of
You
me.
do, no,
Okay.
no, you don't, you did not have a resolution. I wanted to, especially since I didn't have much else on the agenda, I wanted to be able to kind of explain this tonight, and then at some point on the finance committee, we can put it on, and that will have allowed you all time for thought and questions, and you can have a copy of it by then.
There's one agenda item for next week. I guess it would be good to see what the benchmarks and the goals or what they're offering as.
Well, we will give you a
deliverables
copy
at
of
that
their proposal, and I can get that to you before that finance meeting, so you have the whole entire plan that they have. I mean, it's
Are we
not-
gonna put the Glendon Hotel in there, Mark?
Where's Barry?
Are we ever gonna? Yeah, where's the Steve Barron Memorial Glendon Hotel?
He's getting that Sprite sign.
We said, are we gonna have them presented to?
I'm gonna hang it from his house.
Okay, what else do you have left?
Just a,
Oh, I'm sorry,
Real
Bill.
quick, so they're gonna get with the employers of the valley too, and down the road in this strategic plan, find out where the needs are too?
part of it.
Because, the entry-level positions and,
Yep, part of it is understanding what types of employment our community has, and sort of a range of minimum wage up to, and, what's the largest growing sector, employment sector, to be able to know what kind of folks are coming in.
because nobody's building this stuff. They're building the high-end stuff, and that's
Right.
it. That's a
Right.
big problem.
Right.
It's a real big problem.
Well,
They
even
can't afford
post-
to live in the valley. It's $1,500 for a month
can't.
for something that's kind of like,
Yeah,
so.
no, you cannot. In fact, we were just talking about this,
Yep.
and I'm so frustrated that.
They won't come here.
Never mind, I
Yeah.
won't get on my soapbox here.
Okay.
But yes, that absolutely has to be part of it. They have to understand what kind of the income levels of folks here, and what is coming in the future, to be able to know, assess the different needs, like post-COVID, for example, all the New York and New Jersey folks coming into the county to, get out of the city, or New York in particular, but,
There's gonna be some.
so there's just a lot to look at.
It's a great idea. Thank you.
I always hear, like, there's lots of data everywhere. It's about what we do with that data, to Mr. Cusick's point. And so this is finally the hope is to take all this data and actually do something meaningful with it, so.
Okay,
Okay,
There's some low-end housing gonna be built in Southside Easton in the next year.
all right, they
Silk Mill?
broke ground, right?
They broke ground.
Silk Mill?
Yes,
Yep.
I just spoke to Mr. Robinson yesterday.
I would love to see every new housing development have a certain small percentage of obtainable housing, but that's all I'm going to say on that topic. Ready for my
I'm
next?
ready.
Okay, just two other things. First, I don't, is Lori even still here? No, she flew the coop. You know, I've talked about Lori before and the work that she's done. I have not, I just told her recently, number one, I have no idea how she survived the first year and didn't quit. And I knew that at the time, and now, almost 3 years later, I just have such a different level of appreciation for that. She inherited the worst mess I've seen and managed to clean that up significantly in the first year alone, and has just done fantastic things. And she has a very good team, as she would tell you. And I have been so impressed with them during COVID. The level of attempting to keep our seniors engaged, even if it's only on the phone. Loneliness is a huge problem, we all know that. And so I'm really proud of all the work that her team has done in trying to keep seniors engaged. So I said to give that shout out. Oh, and flu shots are for folks 60 and over who are senior center participants. So I just wanted to make sure we said that. So,
Yeah, I won't sneak in.
thank you. Sorry about that. Call ahead.
Not even 60 yet.
The only other thing I wanted to briefly touch upon, Mr. Myers heard a little bit about this yesterday. I think I may have mentioned here, we formed an implicit bias work group, I call it, at within DHS. After the death of George Floyd, I got a lot of feedback from staff and decided with the county exec that this was something that we could do and focus, you know, we don't have control over the whole county, but we can focus on DHS. And so I worked with the directors to identify strong individuals within each department, both people of color and both white people, to work together and figure out what it is that we want to, Mr. Myers is laughing at me, figure out what we want to focus on in DHS. So the number one thing was training, but we also want to get to the point where we look at hiring practices. And I can tell you that since Julie Bader became the assistant director and now the director, part of it relates to the way civil service used to test. It used to be a question and answer written test. Now it's just based on education and experience and training. We have more people of color coming in to children and youth in the last year than probably 5 years combined. I don't have exact numbers. I could certainly get those. So I'm excited about that. But the big piece is training. And so we have interviewed a few different folks and are close to making a recommendation to the county exec as to who we would like to use for that, to focus on, we've all had diversity training, and that's important, but we're spending time now on the implicit bias and getting people to understand that we all have biases, not necessarily racial biases, but certainly we do, and how do we come to recognize those in ourselves to make it a better workplace, but also, just as important, if not more important, how does that impact the work that we do in human services every day? So I'm really proud of that group of folks. It has been energetic, respectful, and I think we're going to see some good things coming out of it.
Any update on civil service?
Yes, we got our most recent list of here's what you need, and we are working on that. Interestingly, I found out, Georgina had a call with them this week, and they said the reason it is taking them so long and so many back and forths is because of the volume of materials that we sent them. I think they were very overwhelmed. I got the impression that we sent them far more than any other county. So it's taking a long time to weed through it. But I really do think we are at the tail end, and I'm still hoping for a Christmas miracle, but stay tuned.
Yes, Mr. Myers.
First of all, thank you for allowing me to attend yesterday's meeting.
Thank you for attending.
You did start diversity training with members of your staff, correct?
They've all had diversity training at some point. Let me take that back. It is my understanding that they have all had diversity training at some point. Children and Youth that's where most of our folks come through. And so as far as I know, that is part of the 120-ish hours of training that caseworkers receive. But I can certainly find out what that curriculum is for you.
Okay. What about diversity training amongst themselves and peer dealing, when they're dealing with their peer, their peers, when dealing with their peers? Are we doing any training with that? Because you have brought in more people of color. So I'm hoping that we're also having training for those that are employed.
Well, the answer is that's why we formed this group. And
Okay.
I know there were some people who wanted us to immediately have training on board, and I said, I don't want to rush and get it wrong. I want to take a little bit of time, not a lot, but a little bit of time and get it right. And so the goal of this group, it's not a once and done training. This is an ongoing, not only an ongoing training, but part of it is with supervisors to understand how to have these hard conversations about race in their daily interactions with their staff and in, formal supervision, not just as it relates to the folks they serve, but also to their peers, absolutely. So I can find out if folks have already had that kind of training, Mr. Myers, but that's exactly where we're going.
What's our number of supervisors that are people of diversity?
I'd have to get that for you.
Okay.
I will tell you, I think I was telling the county exec recently, we had a position, and I told our implicit bias team, we had a supervisor position, and I forget what division it was, and we had about three or four applicants, and all applicants were people of color. And I was excited about that. And part of that is because in order for there to be, we do most of our promotion internally. In order to be able to have additional supervisors and managers who are of color, you have to have them in the door in the first place. So we're getting to a place where we have a lot more folks, and the goal is to help them, anybody who walks in the door, but to help them, work their way up and be able to have more people of color. We want our staff to resemble the folks that we serve.
Yeah, it's important because, I can make jokes about it, but it's crying shame when you go to a place and you're the only licorice stick in a glass of milk. It's embarrassing. Did you quite not get what I said? When you're the only black in the milk, that's what I'm talking about. So that, we need to make sure that we do that because we all don't articulate the right way. And sometimes you may have a conflict that somebody else may have to step in to explain to the other person this is what it's all about. So that's what I was trying to get out with that point. And feel free, if you ever need to lean on me for my experience, and I'm available.
I appreciate that.
I have 1 second left. Do you have anything else?
No.
How's the Remus project? Is it up and running or?
Yeah, it's already finished. No, we had our second phone call with her and scheduling the next one, which will be for her to, and myself and whoever else wants to, within DHS, to shadow our screener. So the person who gets those phone calls with the allegations, to see how one of our screeners, and he's a man, obviously, how he works through that process to be able to figure out kind of how they can, all the technical pieces of it that I'll bumble, so. But yep, we're moving along.
Okay. I need to adjourn the meeting so we have enough time.
Motion.
Set for the regular. Thank you.
Yes, we all have to do that.